Good afternoon. Welcome. Thank you for joining today's APM Incentive Payment webinar. Today's call will provide an opportunity for participants to ask questions about the 2021 Alternative Payment Model, or APM Incentive Payment, for qualifying APM participants, also called QPs, or APM entities associated with QPs. Now I'll turn it over to Corey Henderson from the Innovation Center at CMS to begin. Corey?
Good afternoon, everyone, and if you're calling from the West Coast, good morning. So we are excited that you joined us today for the Quality Payment Program APM Incentive Payment call. Today's call is going to focus on three things. One, how to access the APM Incentive Payment information, scenarios to receive the APM Incentive Payment, and also how the APM Incentive Payment was paid and is ready to be paid for clinicians. The last one I just mentioned, we want to make sure if you are a surrogate for a clinician, that you let them know that we have a process by which they can then go check their name on the public notice and receive payment by updating their Medicare billing information. They have till November the 1st, 2021. If you are a clinician, we hope that you learn today about how you can also check this information on your own. Next slide, please. As we said, this presentation, as always, is not a legal or binding document. This is just a presentation of a summary of all information we have available in the resource library. So we hope that you'll take the time to learn about that information by going to qpp.cms.gov. Next slide, please. So without further ado, let's talk about the overview, the APM Incentive Payment overview, the using the QPP portal to learn about the APM Incentive Payment, and then we'll take questions and answers for our help and support section. Next slide, please. I'm going to pass it to our next presenter. Brittany?
Thanks, Corey. Next slide, please. Just by way of background on the Quality Payment Program, to make sure we're all clear about who we're talking about in this presentation, there are two tracks of QPP. One is the merit-based incentive payment system, and that's sort of your default status. Most eligible clinicians are going to be MIPS eligible, meaning that they would be required to participate in this program or in that track of the program, unless they earn QP status. So the other track of QPP is for advanced APMs, or advanced alternative payment models. And participants in advanced alternative payment models have the opportunity to earn QP status and thereby be excluded from MIPS participation. Next slide, please. In this graph, you can kind of see a little bit more clearly the buckets that you might fall into within QPP. MIPS eligible clinicians, it's a pretty broad term, and really just refers to Medicare enrolled clinicians for the most part. To be MIPS eligible, you'd have to meet certain criteria, such as meeting the low volume threshold and things of that nature. But most eligible clinicians will be considered MIPS eligible clinicians unless otherwise excluded. Participating in an advanced APM does not mean that you are not a MIPS eligible clinician, but being a QP does. So if you earn QP status, you get out of MIPS. It's a get out of MIPS free card. There are also clinicians in our advanced APMs who earn what is called partial QP status. If you earn partial QP status, you have the option of participating in MIPS and potentially earning an upward or downward payment adjustment based on your performance in that track of QPP. Or you can opt out of MIPS and take your partial QP status. However, partial QPs are not eligible for the 5% incentive payment that comes along with QP status. And I'm sure you'll hear a lot more about that 5% incentive payment throughout this presentation. Next slide. Another way of sort of visualizing who we're talking about here is, again, most clinicians start out as sort of being MIPS eligible clinicians. And then in this Venn diagram, of clinicians. You have APM participants generally, and then within that group, you have MIPS APM participants, meaning that you're in an APM that will earn you certain incentives and perhaps credits under the MIPS track of QPP. And then within those, all advanced APMs are MIPS APMs, but within the advanced APM participant pool, that's where we will find our QPs and our partial QPs. But again, being in an advanced APM does not necessarily mean that you will be a QP. You have to get over that QP threshold, which we will talk about some more in a moment. And for those of you, again, who do earn QP status, you would be excluded from MIPS, and you would be eligible for a 5% incentive payment on Part B claims for performance year 2021 and 2022. And yeah, so go on to the next slide. So in order to earn QP status, as I said, you would have to get over what we call the QP threshold. There's actually two, the payment amount threshold and the patient count threshold. The Consolidated Appropriations Act of 2021 actually froze the QP threshold. It was slated to go up for 2021, but it's now frozen at 2020 levels. And so it's going to remain at their current thresholds. For the payment amount, it's going to be 50% of your covered professional services that would need to be through the advanced APM. And for the patient count threshold, you would need to be seeing 35% of your Medicare patients through that advanced APM in order to earn QP status. And just to be clear, we actually do this QP threshold calculation at the APM entity level first before we start looking at individual performance. So usually most people are earning their QP status through their APM entity. Next slide. So just to level set a little bit, make sure we're all on the same page, what we're talking about here. When we talk about the APM entity, we mean the group of eligible, well, we mean the organization that's representing the eligible clinicians. Actually, doesn't necessarily have anything to do with TINs, that's a little confusing, but we're looking at the participation list that we gather on each of our snapshot dates throughout the performance year. We have 3 snapshot dates on which you can earn QP status. That is March 31st, June 30th, and August 31st? Yeah, sorry. And if you're on the participation list of an APM entity on those dates, then we consider you a participant in an APM entity. And that's the organization that will have a contract with CMS or that will be governed under your governing regulation or statute. And that's the entity that we will be using to calculate your QP status. A qualifying APM participant, as we've mentioned, is an individual who has crossed either of the payment amount or patient count thresholds for a performance year and will therefore be excluded from MIPS. And when we talk about a billing NPI, we're talking about the identification number that an individual healthcare provider, an organization will use to process payment claims and other administrative transactions. And I think Tanya will go into a little bit more detail on that in a moment. Next slide. So again, here, who we're trying to reach out to and who our intended audiences are the QPs who've earned incentive payments and APM entities that are participating in advanced APMs who could be earning QP status and therefore their participants are becoming QPs. And we would really like to help you here to understand who's earning the incentive payment, how it's getting paid, who can see details about that payment, and what you can do if you are confused about any of those things, where you can gain more information. And spoiler alert, qpp.cms.gov, the QPP portal, is where you should be able to find all the relevant information that's pertinent to you, either at the QP or APM entity level. Next slide. And here I'm going to turn it over to Tanya, who is our APM Incentives SME, to tell you more about that. Tanya?
Thank you, Brittany. Good afternoon. My name is Tanya, and for the next few slides, I will provide you with a brief overview of the APM incentive payment and some frequently asked questions. Next slide, please. In accordance with the statute, APM incentive payments will be made to eligible clinicians who earn QP status in performance years 2017 to 2022 in each of the payment years through 2019 through 2024. The APM incentive payment is equal to 5% of the estimated aggregate payment amounts for Medicare Part B covered professional services provided by each QP during the base period. And I just want to make a note that the base period is the calendar year preceding the payment year across all billing TINs associated with an NPI. Next slide, please. The APM incentive payment is based on the paid amounts for Medicare Part B covered professional services earned by the QP across all of their TIN and PI combinations during the base period. And once again, not all Part B services are covered under the APM incentive payment. The last bullet that we have listed here is for reference, so that if you want to find additional information out, you can pull that information out there. Next slide, please. So getting into some of the questions, actually, I get a lot of questions where people want to know, why did I receive this money? So very simple, funds are received because an MPI has been identified as an eligible clinician participating in Medicare. The eligible clinician was identified on a participation list for an APM entity group. The APM entity group participated in an advanced APM. And for the last three bullets, I just want to reference that this is based on if you earned QP status in 2019, then we will look at your billing for 2020 for your covered professional services. And then in 2021, you would receive that 5% bonus off of your claims that were billed in 2020. Next slide, please. And something that we will talk about a little later, but we've had instances where we need to request billing information due to the fact that we try to make a payment and for whatever reason we're unable to. So then we do send out, we put out a public notice and we send out a form that needs to be filled in. Now, sometimes when those forms come back, they are illegible because it's hard to sometimes distinguish between the letter O or the number 0, or if it's the number 1 versus the letter L. That is a reason why your form could be rejected. And another occurrence of that happening is when, as we mentioned earlier, we need the billing Medicare organization ID, and a lot of times we're finding people are providing an individual and not the billing organization's ID. Next slide, please. So earlier, I kind of discussed a little bit about the QP performance period, incentive base year, and the payment year. And this graph here pretty much shows you how the process works. And as Brittany had stated, we do have the snapshot periods. So for this presentation, we're looking at the performance period for 2019. And then we look for your payment base year of 2020, and then you would receive that 5% on your in 2021 based off of your 2020 services that were billed. So this is just like a graph of what we've already gone over. Next slide, please. Another question is, what happens if I'm no longer practicing, or I'm no longer with the TIN that I was with? Will I still receive my payment? So the answer to that question is yes, we will attempt to identify any billing activity during the base year to locate a billing organization. And then if that billing relationship during the base year is no longer valid, we look for current billing relationships. And at that point, if we're unable to find any active billing arrangements, that MPI or QP name will appear on our public notice, and they will have that opportunity to provide current billing information, and it would be it would need to be received required by the specified date that is later of the 60-day deadline or November 1st. So as Corey mentioned in the beginning, if you or someone you know has not received their payment, please have them look up on the Federal Register, see if their name is there, and get that information in by November 1st. Next slide, please. Another question that we tend to get a lot is why the payment is low. As a QP, your payment could possibly be low due to the fact that there has been more than one TIN identified. So therefore, we split the payment between those TINs. And then for a TIN, the reason why your payment could be low is the fact that there may be QPs who are no longer affiliated with your practice, or they're associated with another TIN and their payment went to that TIN. Slide 19, please. Big question is, why does it take so long to get the incentive payment? Well, the reason why it takes so long is I just like to remind you that the payments are made 2 years after receiving QP status. A lot of things can happen during that time. People move around with jobs, maybe they're no longer billing, whatever the issue may be, there's a reason why. So what we do is we try to make sure that all that information is up to date, and we use the PAYCO system as a way of a verification for checks and balances. So it's extremely important that you are making sure that your PAYCO's information is updated and is current prior to knowing when you're going to be receiving your incentive payment. And if you need more information about PAYCO system, you can review that in the appendix of the slides. Next slide, please. Now, the reason why the incentive payments are usually done more than once is because first, when we're first doing the payments, we're looking at all payments that are where the QP is still billing with that same TIN that they had earned their status. So if that's the case, nothing has changed from 2 years prior, payment goes through, great. The second round of payments occur because a QP is possibly no longer with that organization during the base year, but they're actively submitting claims through a new arrangement. So that would require us to send out another payment. Now, once all of those actions have been taken, that is when we will go ahead and put out the public notice to notify all QPs that we have not been able to pay you, so please submit us with some current information. Next slide, please. And this is like an example of why payments aren't made at the same time. And it's usually due to, one, a reassignment of benefits that was in place during that base year, but it's been terminated and a new reassignment has been in place. And the other instance is a physician assistant who is no longer employed by the practice during the base year, but is employed by a new practice. So those are just some of the reasons why. Of course, it's not limited, but those are basically the main reasons. Next slide, please. So a lot of people have a lot of questions about the payment TIN. So I'm going to, this is a graph to try to show how this works. So for 2021, what we were doing is we're looking at the base year, the performance year, the payment year. Okay, so everything is fine, group one, great. But the payment follows the NPI. So therefore, what this box is representing is that we looked in the performance year, but then we realized we couldn't find anything, so we're looking at the base year and the payment year, and with that, we'll make that payment to that group two that we have displayed in the graph. Now, we are proposing for 2022 to look in the performance year, the base year, the payment year, and that would be the TIN where the money would go to. And that I know it's a little confusing, but that's basically what it kind of looks like laid out in a very simple form. Next slide, please. So payments are usually split because there are multiple billing organizations with the same APM entity. So that is why some payments are split. Next slide, please. And I just like to reiterate that the APM incentive payment is for the QP. It is not for the ACO. It is not for the entity. So the money that is earned by the QP is for the QP, and it's not entitled to any portion due under QPP rules. And the last thing I just want to mention is a lot of times people want to know how to recognize the incentive payment in their billing. So there's one line, an addendum line, and it will read as CMMI QPP NGS. And then on the 5th or 6th, depending on how it prints out, you will also see where it says CMS QPP QPIN. And that concludes my portion of the webinar. I will be turning it over to Damon, and he will walk you through some of the portal information. Thank you.
Next slide, please. So I will briefly talk about how QP incentive information can be accessed via the QPP portal. So basically, this slide is just an overview of the access that the user role at the APM entity provides. I won't spend a lot of time on this particular slide. However, additional information can be found in the user access guide on the QPP resource library. Next slide. So as Tanya mentioned, the APM incentive payment is for QPs, and the payment is made to their payee organization or TIN. Therefore, when you are accessing this information via the QPP portal, you need the appropriate user role to access this information. The information is available using the practice level user role as well as the individual clinician level user role. Information is not provided to entities that have the APM entity user role because, as Tanya mentioned, the APM entity is just a means for earning QP status. The APM entity or ACO is not entitled to the APM incentive payment. Therefore, we do not make any APM incentive payment information available at the APM entity level. Next slide. Okay, here, if you have clinicians in your practice, or if you're a clinician that is a QP, when accessing the QPP portal, you will see a line on the left-hand navigation of the QPP portal that states or shows APM incentive payments. Now, you'll only see this if you have an APM incentive payment as a QP or as a practice if you have clinicians in your practice that are QPs that have earned a payment. If you access the portal and do not see this information on the left-hand navigation, this means that there's no one associated with your user role that has an APM incentive payment. Next slide. Okay, here what we're displaying is the 10 level view or practice level view. And when you go into the portal using the practice level view, we provide information for all of the clinicians in your practice that are QPs. And so there's a breakdown of what each clinician earns as a QP that is associated with your practice, as well as an aggregated amount of the payment that is being made to the particular practice for the QPs that are associated with your practice. Next slide. This is just a continuation of the practice level or 10 level view. As you can see, we display how many QPs are in your practice with the total number of payment associated with those clinicians, as well as we provide the status of the payments, whether or not the payment has already been processed whether or not it's still being processed or whether or not, we could not locate billing information and therefore could not be processed. All of that information is available in the QPP portal. And again, this is the practice level view. Next slide. Here we have the NPI level view. Again, we provide sort of the same information. However, it's for the individual clinician. Therefore, if the clinician has earned payments across multiple practices, then we display that information for each practice that the clinician has earned a payment. And so we list that information out here, as well as the number of billing organizations and the amount of the payment that the clinician earned. Also, in the NPI level view, we also provide the payee organization that the actual payment was made to. And so that information can be found here as well. Next slide. Again, this is a continuation of the NPI level view. And if you have access to both views as a user role, then you can toggle between the practice level and NPI level view. But again, the information is pretty consistent that we provide the aggregate APM incentive payment amount, as well as how those payments are broken down across practices that you participate with. Next slide. Okay, and I think that concludes the QPP portal portion of the presentation, so I'll turn it over to Corey.
Thank you, Damon. Next slide, please. So we wanted to make sure that you knew that there was still SERS support available. SERS is for our small, underserved, and rural support. And with SERS, although there are a lot of resources there, everyone doesn't fit into this category because you have to have less than 15 clinicians in your small practice. So if you are not a small, underserved, or rural support practice, we still offer technical support for the eligible clinicians. And that support can be found in 3 places, either on qpp.cms.gov. You can also call our service center, and they're always available to help you during our office hours. And that information can be found right on qpp.cms.gov also. And then finally, if you're in an advanced APM or a model within the Center for Medicare and Medicaid Innovation Center, then you will be eligible to participate in our learning systems, in which we share best practices and also offer a lot of support around successful participation in those alternative payment models. Next slide, please. Finally, we wanted to make sure that you are also aware that we're always doing some form of human-centered design or research to better understand how we can meet the needs of our clinicians, surrogates, users, or anyone in healthcare. So generally for Medicare and Medicaid, as we do these designs and we work on some of the slides that you saw that Damon presented, the organization of the information in the slides themselves, that all comes out of research. We don't just come up with the idea, but we bring it back to you and we ask, what do you think? Is this helping you with eligibility? Is this helping answer questions with reporting? And how is this helping you with receiving the APM incentive payment and or your payment and information around it? So we ask you, because we want your information, your support, and your interest, please send your information, name, title, topic of interest, and organization to QPP user research at cms.hhs.gov, and we'll add you to the list of participants and organizations that we contact whenever we have different things we want your user feedback on. Next slide, please. And because we know many of you have come today to support us in our understanding about the APM incentive payment and your understanding of the APM incentive payment and or where your payment is, I'm going to pass it back to Ketchum, who's going to help us with the Q&A. Thank you.
Thank you, Corey. So we will now begin the Q&A portion of the webinar. You can ask questions via the chat box, which many of you have begun to do, and we will read those aloud, or you can choose to ask your question over the phone. To ask a question via phone, please toggle the green hand icon on your go-to menu and we will unmute your line. For those dialed in via phone, to ask a question live, you must have your audio PIN entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. So while we wait for those who may be interested in dialing in via phone and raising their hand, we'll ask a couple of the questions that have come in through the chat. Can you provide more detail or resources on providers who are assigned to an APM but who don't participate in an ACO?
Can you repeat that question one more time, please? I want to make sure we answer it clearly.
Sure. Can you provide more detail or resources on providers who are assigned to an APM but who don't participate in an ACO?
So before I pass this to one of our SMEs to answer, from a communications perspective, our resources provide information generally around APM participation, and we have a separate resource around the Shared Savings Program. ACOs are a specific subset of APMs, and we want to make sure that there's a clarification around the two. Every APM, as the question proposes, is not an ACO. So I'll pass that to Damon or Brittany or any of the other SMEs on the line to talk about other resources. But you also consider the Center for Medicare and Medicaid Innovation Center, our learning system, if you're in an APM. Anyone else want to add anything to that? And generally, you can find information by going to innovation.cms.gov, innovation.cms.gov. If your organization that you find your APM under, you're in an APM under that organization, and maybe you didn't know it, you can go to innovation.cms.gov, look up what type of model you're participating in, and there are also additional resources there that can help you while you're participating in your APM.
Yeah, and this is Damon. I will also say that most of the resources that are on the QPP resource library as it relates to APMs are meant to encompass all MIPS APM participants. And our scoring policies apply to all, regardless of, which type of MIPS APM you participate in. So there's additional, there are a number of resources on the QPP resource library. But if you have specific questions around how your model participates in the program, then please submit your question to the QPP Service Center, and we can address any questions that you may have there as well.
Thank you. The next question that we have received through the chat is, what if a physician retires after their incentive determination year? Could they receive payment as an individual?
This is Tanya. As long as there was some sort of billing, whether it may have been like supplemental services, their name would appear on the public notice if we're unable to locate any current billing information. So they would need to check the public notice.
Great. Thank you, Tanya. The next question, if an individual meets QP status in the first snapshot, can that change in the second or third snapshot, assuming the APM entity still exists?
I don't know if this is Damon. I don't know if Brittany wants to address that, but so typically, if you earn QP status with the first snapshot, your status typically wouldn't change unless your APM entity terminates from the APM that they participate in prior to the third snapshot. So if your APM entity that you earn QP status through terminates from the model prior to the last QP determination snapshot, then yes, you could lose that QP status.
Right. And I would also just note that while the information that we're providing for the first and second snapshot, as Damon said, typically you're not going to lose that status. These determinations are made on the assumption that our participation lists that we have on those snapshot dates are accurate and have been updated. And so if, for instance, your ACO or your APM entity failed to update certain information with the APM that you're participating in. Let's say you have an ACO that actually dropped a TIN back in March, or we'll say even like February, but they failed to tell CMS in a timely manner. And so those participants turned up on the participation list, but they were never actually a part of the APM entity. Then we would take them off the list of QPs going forward, because even though they turned up on the snapshot, that was an artifact of the participation list not being updated. So if you are really and truly participating in the model on a snapshot and you get QP status, you're going to keep that QP status unless your entity terminates from the model. Again, provided that CMS has accurate information on those dates.
Thank you, Brittany. Before we move on to the next question in the chat, we did want to encourage folks to look at the chat that is coming through. We've shared several links to resources, one of which is the Federal Register link that has the information about the 2021 APM incentive payment. Someone did inquire about that link. So please check your chat and you will be taken to some of the resources we are discussing currently. All right, next question. APM ACOs pay the providers. CMS pays the APM ACO. Isn't the APM/ACO score just providers are? If the score is high enough, do they get extra money?
Thanks for asking that question. I had a little bit of back and forth with the inquirer, and I wanted to answer this question because I've gotten a couple similar questions, and I just want to make sure we're all speaking the same language here. So you are participating in an advanced APM. We'll just say, for sake of this hypothetical, we're talking about the shared savings program. You're participating in the ACO, you're going to earn a score based on quality and based on your cost savings, and the shared savings program itself is going to, maybe you earn shared savings, or maybe you have to share in losses. Whatever that score is and however those payments work out, that goes through your ACO, because the ACO is your APM entity that has the contract with CMS for participation in that APM. QPP is for, we say internally, QPP is for humans. We look at individual humans and what your status is. And so when you earn QP status, that attaches to you at the NPI level, and it follows you across all of your TINs. So we are not making a payment to your ACO. We're making a payment to you, or for you, as a QP. And so we're trying to make that payment to a TIN that you have reassigned your billing rights to through Paycos, but it is not to or for or necessarily through your ACO. So the payments for QPP are entirely separate from the payments that you're going to be getting through whatever APM it is that you're participating in. So I hope that answers the question and clarifies a little bit how the money is flowing through the quality payment program versus whatever other APM you're participating in.
Thank you, Brittany. It looks like we might have a phone question, so I'm going to see. Joy, can you unmute the line of Emily Levy? Emily, you should be able to speak.
She's unmuted. Hi, can you hear me?
Yes.
Hi. So I've been a little confused with the recent change to combine HARP and ACO-MS status, and we've recently been getting some requests from users in our health system to be accepted as a QPP role, and I just want to understand if we need to be accepting all of these folks in our ACLMS so then they can access the payment in QPP, or if it's totally separate and we don't need to be accepting them. They may be requesting this out of error. I think there's just been some confusion. In HARP, it asks you to align with an APM entity. So if they do that, then we get a request in our ACLMS to accept a user as QPP. So I just want to, one, make sure if we do that, this won't give them access to our ACLMS, and two, just make sure, clarify if we should be doing that or if they don't need to be.
Yeah. So this is Damon. This is Damon. I can speak to this. So this is a recent new requirement for the shared savings program. So previously, user roles were created through the QPP portal using HARP. However, that user role creation and management is now happening within ACO-MS. And so if you're requesting a security or staff user role for an ACO, that has to be done through the ACO-MS system. So I would defer you to the shared savings program around that particular topic. But gaining access.
It does apply for this program. So do they need to, sounds like they need to have a HARP account to access their payment. Is that correct?
Correct. And that payment, that user role creation and management is happening in ACO-MS. However, that same user role can be used in the QPP portal to access your APM incentive payment information. However, I take that back because, again, we don't provide APM entity level, we don't provide APM incentive payment data to ACOs or APM entities. So although they may be requesting access at the ACO level, they still won't have access to the APM incentive payment information, but it does give them access to the QPP portal.
So it sounds like it sounds like they may not have needed to request access. If we don't approve them, can they still access? They're waiting for our approval, and so I'm just worried that this is going to start happening a lot with people trying to access the payments, and I'm just trying to understand.
I don't want to misspeak about what process the shared savings program has established for user role creations. Again, I do know that. I'm
talking about the shared savings program. I'm talking about these. I believe these are folks who I believe are trying to access their incentive payment, and I think that that's why they are creating HARP accounts. And so I just want to understand if we don't approve them, can they still access their payment without being connected to us, as in us being the ACO APM entity?
Right. So APM incentive payment information is not made available to APM entities or ACOs. So if they're trying to create a role at the APM entity level, then that information won't be available regardless. I don't know, where you would sit in that particular process in terms of approving those roles, but just in terms of APM incentive payment information, if they're requesting an APM entity level role or ACO level role to view the APM incentive payment, that doesn't exist, so they won't be able to do that.
So I think what I'm hearing is that they may be requesting this unnecessarily, and they should be able to just create their HARP account without requesting the APM entity access. Is that what you're saying?
So I can't speak to their intent, so I don't want to mislead anyone. But I will say that if they want to access the APM incentive payment information, an ACO level role or APM level role is not what's needed. They would need to access it using the practice level or individual level role.
Okay, that's what I needed to hear. Okay, thank you.
And also, very quickly, this is Corey again. I think the best opportunity to see that is the APM Incentive Payment education guide or the fact sheet that we have, the Quick Start Guide. And you'll see in there where it describes the different, with the screenshots, what can and cannot be seen. And if you want to use that in whatever messaging you send to your team or to the organization, you can use that to help define and describe what they're actually going to get with each level of role. So that way they know what they're asking for and why they're asking for it. So those resources are right there on qpp.cms.gov.
Thanks, Corey. We'll go back to the chat and read a couple of these, and then we can go back to the phone lines. So the next question is, if a QP earned status in 2019 and on December 31st, 2020, the QP was practicing at termed, and the QP went to a different 10, but the payment did not transfer to the new 10 and follow the QP, do we just fill out the form at the new 10 to receive the payment for that QP?
Tanya might be able to give you a little more detail on this.
Yeah, this is Tanya. Go ahead, Brittany. Go ahead and finish your thought.
I just wanted to get a clarification real quick. So did the clinician term from one tin and go straight to a new tin, or is there potentially like a third tin in the mix that they were simultaneously practicing in throughout? I think that's relevant information. Sorry, Tanya, you know this better.
No, that's correct, because I was a little confused, because it's one thing if a 10 terms, but if the QP is actively billing somewhere else, then we would make that payment to where that QP is actively billing. So without kind of knowing, is there another 10 in play? If you could provide a little more clarification.
Okay, we'll see if I believe it's Michelle Robinson wants to clarify. In the meantime, we can go actually back to the phone line. It looks like Lauren St. Victor has a question. Joy, can you unmute Lauren's line? Lauren, can you hear us?
Yes, can you hear me?
We can. Go ahead.
So I was just wondering if your QP status appears as not available, does that mean that it just hasn't been determined yet as of the third snapshot? Or is there a way to figure out what your QP status is if it's appearing as not available?
So a couple of things. So when you say if it's appearing as not available, where are you looking to see that information?
In the QPP lookup tool.
Okay. So if it's not available, that could potentially mean that either you're not participating in an advanced APM, and so you're not eligible for QP assessment. Do you know if that's the case for the clinician that you're referring?
So these are practices that are all in an ACO that are participating in MSSP and BIPSI. So they are all in APMs. So they should all have a QP status determination.
Okay, and this is as of PY21, performance year 21?
Yeah.
Okay, so we have to look a little bit closer into those particular clinicians, because there could be a number of reasons why there's no QP determination. It could be based on a number of things. One could be a provider relationship code where, you know, it gets a bit complicated. So if you can submit your question through the QPP Service Center and provide the specific NPIs that you're finding that don't have a QP status, we can definitely look into that.
Okay, thank you.
Great. It looks like Michelle did provide a clarification. We termed the 10 from the ACO, and I believe the provider termed the 10 from Medicare enrollment because they moved to our other ACO and it was employed by a different 10 in 2021.
Okay, this is Tanya. So it seems like from what I just heard is that the 10 had termed from the ACO, and then they're also termed from Medicare, but they moved to a different ACO. So I mean, they still have to be actively billing Medicare in order to receive the payment. But if they are showing that they're currently billing through a different 10, then you could submit a form for that clinician or QP.
Great.
And I'm just going to take this opportunity to reiterate once again, and I think we should say this like multiple times a day to everyone. Please update Paycos the day that you find out that there's going to be a change in your enrollment status, in who are participants in your TIN. Like anything that changes, just update Paycos that day, and that will hopefully help prevent any confusion or issues with us identifying the appropriate payee TINs. Not saying that in this particular case, no one did anything wrong here, but the sooner we have information, the more likely it is that we're going to identify the correct payee TIN ourselves, and then you don't have to worry about filling out these forms.
Thank you, Brittany. It looks like we have a phone question from Tap. Are you there, Tap? And are you interested in asking? Oh, nope, offline. Okay. We will go back to the chat. I think there were originally about 9,000 people who CMS could not find to pay incentives to in 2021. The question is, how many are left?
Okay, this is Tanya. That information is not available at this time. Just make sure if you have not received the payment that you are checking the Federal Register. And if your name is there, please fill your form out and send it in prior to November 1st.
Great. Thank you, Tanya. All right. We have about 4 minutes left, so if you are interested in asking your question through the phone, please put your green hand raise icon up. Otherwise, we can go back to some final chat questions. So how do I confirm APM incentive payment is being made? By looking at the EOB question mark, what should I be looking for?
The remittance, this is Tanya, the remittance will say CMMI QPP NGS, and you will also see on the remittance on one of the other addendum lines, CMS-QPP-QPIN.
Yeah, and just to add on to what Tanya said, so the APM incentive payment is a lump sum payment, and it's not found on the EOB.
Thank you both. Is the incentive only available for APM participants and not MIPS participants?
That is correct. You must be a participant in an advanced APM in order to be eligible for QP status, and only those with QP status will receive an APM incentive payment.
Great. Thank you, Brittany. I think we have time for one more question. Just bear with me a moment. This question is, if a billing form is rejected, is a notification sent?
No, a notification is not sent. If we are able to figure out what the issue is, we may actually reach out via email, or if something came through the help desk, and let you know that, hey, this information was incorrect. But we usually, by the time we go through the billing process, we may not know it in time. So that's why there are additional payment rounds. So if you do submit something and there's something wrong with your billing form and it did not go through, chances are that we will be doing one more attempt to try to make payment.
Great, thank you, Tanya. And I'm sorry, just one more question. Do you receive the payment through the portal or on the claims?
The payment is a lump sum payment. It's not attached to a claim like a normal Medicare payment.
But it will still be paid to the account that you've identified on those, either in Paycos or on those forms. So it's not something that you're going to see necessarily in the QPP portal as a payment. You're only going to receive information about the payment in the portal.
Great. Thank you, Brittany. Thank you, Tanya. So we are at the top of the hour. I'll pass it over to Corey to conclude today's webinar.
Thank you very much for joining us today. As always, we appreciate your participation in our webinars and our learning events. We will be posting these webinars onto the qpp.cms.gov page. We hope that you will then, at this time, go continue to learn about the APM Incentive Payment. But more importantly, November the 1st, we want to make sure all clinicians and anyone who is owed a APM Incentive Payment has submitted their billing information form. Again, please check that out on our Federal Register, and additional information is available online. Thank you again, and have a great day.